Hey everybody, welcome back to my channel. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about how to prevent getting a yeast infection after antibiotics. You may very well have had this in the past or have questions about it. It's so common. We're gonna dive into it today, so come on in. So today you will find out who is most at risk for getting yeast infections after antibiotic treatment. Secondly, I'm going to give you the inside scoop on which antibiotics more likely will cause yeast infections so that you are prepared in case you are getting treatment with this antibiotic. And of course, this wouldn't be my channel if I don't give you tips for how to prevent getting a yeast infection when you're under antibiotic treatment. So let's jump into this. This answer is going to be very straightforward and very simple today. Can you get a yeast infection from antibiotics treatment? Yes, we know this. We've known this for a very long time, but it still is sometimes more of a surprise when it happens, because whenever you're having an infection, the last thing that you want to think about is having a second infection that you will need a second antibiotic or an antifungal treatment for. Nobody wants that, right? So there are things that I think that is important for you to know and help to arm yourself with so that you can actually be very straightforward with your doctors immediately, knowing that the likelihood of you getting a yeast infection is very high. And I have tips for you as far as how to approach that ahead of time so you're ahead of the game and decrease the likelihood of you getting these infections. So what does that look like? Well, whenever you have an infection, that means that you're having either a viral infection, a bacterial infection, or a fungal infection. Now, each of these types of infections require a different type of treatment. So for instance, virally, if you had like a cold, you may not need antibiotics for this, right? Because antibiotics are treatment options for bacterial infections, which is very different from a cold or a virus. If you were to have a yeast infection, for instance, that is a fungal infection. And if you were to take antibiotics for a fungal infection, you will have no response because you need an antifungal treatment for that. And so it's very important that whenever we have symptoms and problems and issues, that we're speaking to the doctors, we know exactly what is causing that so you can get the right and appropriate treatment for you. Now, in the face of antibiotics, antibiotics kill bacteria. And so bacterial infections can come in so many different forms. If you think of it from head to toe, you can have an eye infection, you can have an ear infection, you can have a mouth infection, you can have pneumonia, bronchitis, you can have intestinal problems, gut issues, you can have infections of your gallbladder, your uterus, your pelvis, your vagina. I mean, it just goes on, right? And so with that, these treatments are powerful. And they're powerful because there are usually so many different kinds of antibiotics that can treat many different types of infection, in particular bacteria. And so when you go to the doctor, like if you were to come into my office and we suspect that you have a certain type of infection, like a bacterial infection, we may prescribe to you antibiotics that are really not specific to the infection that you have. And the reason is, we don't really know at that time because there are a ton of different types of bacteria that can cause the same exact symptoms that you're having. And so our approach in medicine is to give you treatment that is considered to be broad spectrum. That means that we're giving you a strong enough agent that is able to kill bacteria of many different types. At any point, if we were to send a culture is a test that is actually done in a pathologist or in a lab in their office. And essentially what happens is that we take a sample of your infection, we send it over to the lab, and they will let the sample grow, the bacteria that's present. This takes about 4 to 5 days. And with that, they know exactly the type of bacteria that's causing your problem. And then we can specifically only give you treatment to that bacteria. However, when we give you broad spectrum antibiotics, that's in the face of not knowing exactly what is causing your problem, because it takes 5 days to know that, and we want to treat you right away so your infection does not grow into something larger or something more serious. And so with that, broad spectrum antibiotics are greater, they are stronger, they are more powerful, and they have the ability of killing more things. This is why we have problems with infections following these treatments, because these treatments are killing bacteria of all different types. And so internally in our bodies, if we are killing more bacteria than we desire to, it causes our bodies to be susceptible to more infections. And this leads to yeast infections in many females. So I hope I haven't lost you here, but let's dive into this a little bit deeper. If you were to get a urinary tract infection, and we gave you a broad spectrum antibiotic, that antibiotic will go internally in your body and will kill a lot of different types of bacteria, good and bad. Whenever we lose our good bacteria, it causes other bacteria to overgrow. And so in the vagina, getting a UTI treatment may cause the good bacteria in the vagina to also die. And so when that happens, the yeast that is present overgrows because it's now in a state that is not normal for the vagina. And so your body then tries to fight this and to correct it. And so with that, it overgrows the yeast. But yeast is not comfortable in an overgrowth scenario because it becomes an infection that comes with symptoms, that comes with problems. And so essentially there's like a domino effect. We're really trying to clear one infection because that's no fun. We don't want to have greater problems. However, it creates other issues in other parts of the body. And so with that, knowing specifically what bacteria or virus or fungus that's causing your problem is very important. And so one of my tips that I'm going to mention at this point is that if you don't need antibiotics, don't take antibiotics. Sometimes it's very common that we may feel as though there's a problem, we just want it to be fixed right away. And so if you have leftover antibiotics from some other treatment, or if you are just uncomfortable, you're just like, please give me something, and that might not necessarily be the best thing for you. So for instance, if you're having a cold, you may not want to get antibiotics because antibiotics are for bacteria and colds are viruses. You may just want to wait it out a few days. Give your body some time, help your system with, supportive measures to clear this virus. And if it doesn't improve within a few days, then we can now reset, look at the table and look at the board and just check out all your symptoms again and test for other things and treat as needed. But sometimes we may get into the mind state where we have a problem, we need treatment right away. And so sometimes we really want to give our bodies time to be able to declare itself and to improve and to correct the issue internally if you're not immunocompromised. What does that mean? If your immune system is compromised, it means that you have an underlying condition that leaves your body weakened. And so your ability to fight things has lessened. If that has happened, then you need to be more proactive in your treatments, but also work with your doctors very, very closely. If you're not immunocompromised, then you really have that time to let your body work in your favor to help to correct these issues and to speak with your doctors to help when necessary, and only take antibiotics when you absolutely need it. So what antibiotics actually may increase your likelihood of getting a yeast infection? Well, penicillins. Penicillins are probably the most common antibiotics and the first that ever developed. So they're used for so many different things, a lot of upper respiratory infections, pneumonia, bronchitis, things like that. But they are almost what I would consider to be the #1 culprits for causing yeast infections. So if you're getting treatment with this, just know you may want to have that conversation with your doctors to actually give you the treatment for a yeast infection right away, because it is bound to happen. Another antibiotic class is tetracyclines. Okay, you might not have ever heard of this before, but I'll tell you some of the common antibiotics in this category. Doxycycline is very, very common, especially in our female world. And that's because it is used for treatment of UTIs, vaginal infections like bacterial vaginosis sometimes. You can have pelvic inflammatory disease, which is caused by having gonorrhea, chlamydia, other infections in the area that has ascended internally and causes bigger infections. It may be used for a lot of common treatments in the female reproductive system. And so because of that, you're also at risk. So if your doctors, again, are giving you treatment for any of these infections, please do ask or preemptively talk about options to and ways to help to prevent having a yeast infection. Lastly, in this category, antibiotics will end in fluoxetine. Okay, you'll see that right here on the board, okay? So ciprofloxacin is a very common one that is also used to treat pneumonia, upper respiratory infections, as well as infections in our female reproductive system as well. These three classes are most common to cause a yeast infection after treatment. Now, it is important for you to not only know this, but to also try to do things in your world as you're getting these treatments to reduce the likelihood of this yeast infection developing. So what can you do? Well, always support your body with probiotics. And so especially when you're getting the treatment, but even before or after, it's important to give your gut and your vagina support to help to keep good bacteria present. And so probiotics does just that. And so you can get those probiotics in many different forms. You can get it in the form of a tablet or a supplement, like a capsule. You may have yogurt on a regular basis. Yogurt in general has a lot of live, good, healthy cultures to help to support your body as you're getting treatment, and also supporting your body by drinking lots of water and eating well. I know it sounds very simple, but water is essential to help your body function at its best. So please, absolutely, you want to intake at least 2 to 3 liters of water per day, in addition to eating a well-balanced diet so that you support your body well. Lastly, there's another option for some of us that you may find to be very helpful, and this is using boric acid. Boric acid has been shown to really help with infections that are from the bacterial side in the vagina. Yeast infections are a fungus. However, we've seen medically that using boric acid in the presence of a fungal infection like a yeast infection may also be helpful. So I would say it doesn't hurt to try to use this to see if it's beneficial for you, but definitely check with your doctors first to be sure that it is safe for you, your condition, the state that you're in, especially if you're pregnant, before attempting to use this. My last tip for you today is that if you are unsure what type of infection you're having, please, before we attempt to use things over the counter or something that's in your bathroom right now, see your doctor to be sure that you know exactly what's causing your problems and your symptoms. And again, if you've had yeast infections before and you know that you tend to get them after antibiotic treatments, be ahead of the game. Talk to your doctors about it. And at the same time that you're being prescribed the treatments that you're getting, I also ask them to give you treatments for yeast infection so that you have it ready to go in case you need it. I hope all of this information today has been helpful for you. Thank you so much for being here on my channel. I'm Dr. Perkins, a board certified OBGYN, and I love to have conversations with you as such. And so leave a comment below today if you have questions or if you've experienced any of the things that we've talked about, because I'm sure someone else who's reading or listening may want to hear this as well. You know that we're in this world together. We are supporting each other, and we experience more things than you may even think of that is very common, but let's talk about it today. I also have a free gift for you today, and so if you've never been to the link below to my website, I welcome that you go and check out all the wonderful things that I have available for you. But in addition to that, I'm so happy to offer you a free copy of my Hormones Don't Lie ebook, where we can talk about things happening internally, how to help your body be its best, but all of the tips that I recommend for you as a female to help you take care of your vaginal space. Thanks for being here, and I'll see you next time.